when you go on contraception, you actually switch off the function of your ovaries. So sometimes or often I refer to contraception as a piggy bank. You save on follicles because you do not ovulate on when you're using contraception.
That's a very interesting fact.
It is, and there's a misconception around that out there. You do not ovulate, which is a good thing.
I mean, one of the concerns is like, if you go on contraception, will you be fertile later on if you stop your contraception?
Exactly.
I think that's one of the main concerns
to people. So the point
people.
is, yes, you will. And all the contraception that we had, apart from the Depo-Provera, is short-lived. The action is short-lived. With a pill lasts for 24 hours. So many women can still fall pregnant whilst using the pill. If you don't use the pill correctly, and that's an indication that it does not really affect fertility. And the other thing is the protective effects of the pill. If you're on a monophasic pill, meaning that you have 24 pills that's got the same dose of estrogen all the time, there is no association with breast cancer. If you are on a triphasic pill, there is a small association with breast cancer. And most people these days are on monophasic pills. It actually prevents colorectal cancer, the use of the pill, and the contraception also prevents ovarian cancer because you do not ovulate every month. So there's not that healing effect where things can go wrong. So there's lots of positive things that one can see that comes from using the pill. So usually I don't like to start young girls until the age of 16 on the pill. I want their hormonal access to form properly. There's other ways how one can deal with heavy bleeding, or especially if they become iron deficient, because I do see that very often. But yeah, if we can start them on monophasic pills, I think we will. If we can get them to understand that it's actually good for their health and beneficial, we will definitely make a difference.
I suppose that's the most common reason why they come and visit you at that age.
Yeah,
excessive bleeding.
And we have so many options available these days that it's actually nice to be able to provide young girls with options where they don't have to take the pill. They can use intrauterine devices that contain safe hormonal depot amounts.
Oh, that's very interesting. I didn't realize that you save your follicles.
Yeah. And it's also, a lot of the people listening will be mothers, and there's a lot of pushback from the mothers. No, I don't want my child on contraception at 16 or 17 or 18. And I think that's quite nice to hear that it's actually good for your health.
It's actually good. Yeah. I will never use of preventing ovarian cancer as an indication to start contraception, but it is an added benefit.
Of course, you're going to start contraception if there's an indication for
Absolutely.
it.
And indication is not just always sexual activity preventing pregnancies, but it could be skin or heavy bleeding, skin issues, heavy bleeding that we need to control. It's just so much easier to do it with a combined oral contraceptive pill than giving them separate hormones to take, especially if they're in adolescents or young students that doesn't have a routine, so there's so many options that we can use to make life easier for them.